Welcome to the Frozen Shoulder series. Today we're going to talk about part 3, Frozen Shoulder Facts. Okay, so here are some frozen shoulder facts. Rarely does a frozen shoulder result from underlying disease. If we look at this joint above where the arrow is, that's the shoulder joint, and it looks completely normal. And that's typical for most frozen shoulder patients. The shoulders look completely normal in X-ray. It just feels like something must be wrong. About 50% of frozen shoulders occur from trauma, and about 1 in 20 people in the population suffer from a frozen shoulder sometime in their life. It is more common for women to have a frozen shoulder. It almost never returns to the same shoulder once that's healed, and that's great news. But for those who do have a frozen shoulder that happens in both shoulders, it's only 15% of the time. It usually occurs in that non-dominant arm, so that's great news. And the average duration of time is about 30 to 40 months. It's 5 to 10 times more common in diabetics. It may have a genetic component, it does seem to run in families. And it may have an autoimmune component as well, because we always have inflammation of the bicep tendon with a frozen shoulder. It seems to affect mainly 40-year-olds to 70-year-olds, and that's why in Japan they call it the 50s shoulder. One thing about frozen shoulder remains, it can literally change your life. It can leave you exhausted and frustrated and short-tempered. It can destroy relationships with friends and loved ones. And recent studies indicate that many have to give up their jobs as a result of a frozen shoulder. Frozen shoulders can leave you with residual complications up to 10 years and beyond. So while you won't die from a frozen shoulder, it just seems like it at times. The good news is there's really fine treatments for frozen shoulder. Without surgery, without drugs. Dr. Stetson is an MD. He's an orthopedic surgeon. And he says that 50% of patients go on to surgery if they're only treated with physical therapy. Well, we use physical therapy on our patients, but we also use a number of other techniques as well. And there's a reason why our results are so good. 90% experience very good to excellent results, and we're very proud of that. There is a better way, and we're going to tell you a great deal more about that in the next few parts.